Hello and welcome to the Bernard van Leer Foundation's first ever webinar entitled Learning Begins Early. This webinar was conducted on the 1st of July 2013 and it followed up on an edition of the Bernard van Leer Foundation's biannual journal, Early Childhood Matters. This introduction is being recorded at a later date to fix technical issues that occurred during the presentation. The next voice you'll hear will be that of the first presenter, Dr. Joan Lombardi.
Before I begin, I want to also thank my co-author, Rebecca Sayre, and all of the people around the world who are participating today who brought us to this point of talking about the very earliest years. Today, I'm going to frame our conversation by talking about three issues. Andrew, if you could move that to the next slide. First, I'll briefly review what we know about child development and the status of young children around the world. Second, mention some of the policies that can lead to success. And third, outline next steps we all have to take to move the agenda forward for children under 3 and their families. Let me start by reminding us of what was established more than 20 years ago in the first education goal, and that is that learning begins at birth. Learning does not wait until children reach the schoolhouse door or even the preschool door. Children are learning, children are born learning. What they learn and how they learn it depends on the conditions under which they live and the experiences they have in the earliest years of life. Over the past few decades, we've had a dramatic increase in the scientific evidence that supports learning. We know now that children learn through relationships, through their interactions with caring adults. Parents and other caregivers respond to their needs and cues, which provides the critical response leading to trust, confidence, curiosity, language, and other skills that form the basis for learning. It's actually these interactions that we now know builds the architecture of the brain. We also know, as shown in the next slide, that children's development follows a trajectory, a developmental path. We know that certain factors can undermine this development while other protective factors can support this development. If we look specifically at the risk factors, we know, as the next slide shows, that these risk factors include poverty, lack of health care, malnutrition, societal violence, maternal depression. And Chiara will also mention some of these in her presentation. On the other hand, if we look at the protective factors, early health and nutrition, improved economic conditions, and strong and supportive families and communities can support development. Our goal as early childhood development advocates are to increase the protective factors and reduce the risk factors. Turning now to what we know about the status of children around the world. We know that there are more than 130 million children born around the world each year, the majority in low and middle income countries. Although we've made progress, child mortality has fallen by more than 40% since 1990. In 2011, there were still about 6.9 million children who died before reaching their 5th birthday. On top of that, it's estimated that more than 200 million children below age 5 living in low and middle income countries are not reaching their developmental potential. Even in wealthier countries, we're seeing poverty and inequality growing, and this is a tremendous concern. Despite the knowledge that we know we have about the importance of the first 1,000 days, almost 27% of children around the world are moderately or severely stunted due to poor nutrition, making them more vulnerable to disease and undermining their early learning. It's important for us to make this link between nutrition and early learning. Going on and looking at some of the UNICEF mixed data, We know that from a review of 20 countries that the poorest children are at greatest risk of being left home alone or with inadequate care. At the same time, the next slide shows that children in the poorest households are less likely to access early childhood education programs. Now, this data is from, the next slide, please, Andrew. This data is from children that are 36 to 59 months old, showing us once again that our data is often for older children and not younger children. We're continuing to refine that data. If we then turn to the policies that lead to success, as we continue to give voice to the conditions that face children, we have to better understand the policies we want to see put in place to change the statistics that I mentioned. This figure is a slide that depicts the policies we're after with a two-generation approach. We know that to promote healthy development, we have to focus our policies on the conditions that affect both children and their parents and extended family, including starting with adolescent health, good prenatal care, maternal health, the conditions that result in a healthy birth, family support and parenting, and child health and nutrition, quality early childhood programs. But we can't stop there. The slide that Andrew moved towards depicts the same two-generation approach, only as a pathway, because we know that children do not learn from a single program, but it's the continuous interventions of services that make a difference. I want to especially point out that our policies have to not only affect focus on the programs such as parenting and quality early childhood services, but we have to be concerned with the family economic supports and the ongoing education of both mothers and fathers, because we know that the economic conditions that affect the development of children. And so we have to be concerned with this entire pathway, including quality primary schools. Because if we do our job in the early years but forget to improve the quality of the primary grades, we know that their development can be compromised. If we move on, regardless of the particular program, we know that all of these services have to be of high quality. It's not enough to just access services. We may have to make sure that those services are quality. For example, we're learning more and more what works in parenting programs, whether they're home visiting programs or social networks of support where we're bringing parents together. What we're learning is that structured curriculums with active involvement of parents make a difference, that training and supervision of the staff increases effectiveness, that duration and intensity, in other words, how many home visits, how much we're interacting with parents makes a difference, and that targeting the children in the most need is particularly important. Again, with parenting programs, we know that economic supports and maternal education and outreach and support for fathers have to be part of the picture. So it's important for us to continue to learn what works, since we know, moving on, that from the global monitoring report that was done a few years ago, that there is much less investment in the earliest years of life. So we have a long way to go. The question is, what can we do as a world community concerned with child development to move the agenda forward? I'd like to go through 3 steps quickly that I think we all have to take to move towards increased investments. First of all, we have to improve data, not just globally, but nationally and in communities. The data often focuses mostly on older children, and we have to start our focus on data with birth registration. We still have tremendous areas around the world where children's births are not being registered, and that's the first data point often that follows children through their developmental period and also often stands in the way. We have to have data that looks at the conditions that impact child development throughout the developmental period, as well as indicators of overall child well-being. UNICEF has provided us important steps forward, and I know the World Health Organization is also focusing more and more attention on this. At the same time, we have to continue to look at data that looks at the access to quality services that children are experiencing. We know in the past we've often looked only at access, and now we're starting to fill in the data picture, again, both locally, nationally, and globally. I think one of the important things about our data needs is to focus not only on those data points nationally, but to break out that data by poverty level and by different ethnic groups so that we can really, the data will begin to reflect the realities of children's lives. So improving data is our first step. Secondly, we have to continue to coordinate our planning. We know that child development occurs across developmental domains. That's the rationale for why we need to coordinate. We need to bring together health, nutrition, and mental health, early learning, social protection, and family support. And we need to do this not only at the infrastructure level, not only at the ministerial level, but at subnational level in communities and at the service level. We have to figure out new ways to build one service onto another and to take advantage of the different points we have to intervene with children and families. Finally, we have to build public awareness. In the age of communication, it's easy to have communication overload and information overload, but we're constantly trying to find new ways of telling our stories, both using data and looking at the context of people's lives through stories. If we go on to the next two slides, Andrew, we want to reach out to new players. We've spent a lot of time in the field talking to ourselves. It's time for us to reach out to the health community, and that's why we're so excited to have Chiara with us today, to women's groups, to the business community, and to law enforcement, to economists, to the faith community, and the list goes on. And we need to share those victories that we have with each of those groups as we move forward. In summary, I think we have an emerging vision across the world. The old think learning begins at school. We now know that learning begins at birth. The old think was health or education, and we now know you have to put those two together. Old thinking was care versus education, and now we know that care is education. It's really about the quality of that care. In the old think, you focused on the child or you focused on the parent, and now we know we have to focus on both generations and the extended family. And then finally, we used to talk about transitions from preschool to school, but we now know that what's really important here is the continuity of development from preschool to age 8. There's no magic moment. There's no magic period. We have to assure continuity throughout this developmental period. So with that, I want to, again, this was very short, but a framing for a conversation and for the wonderful work that you're about to hear. I thank you for your vision and for your participation.
Thank you very much, Joan. And just a reminder to everyone who's participating in this webinar, you're very welcome at any point to type your questions into the question box, and we'll store them up and get through them after all the presentations. So next up we have Orazio Attanasio, who's in the Department of Economics at the University College London. And let me throw over now to Orazio to present on his program Enriching the Home Environment of Low-Income Families in Colombia. Orazio, over to you.
Yes, thanks very much and welcome to everybody. Thanks very much for the invitation and the opportunity to present some of the work we have been doing. Listening to Joan was very nice for me, both because, as usual, she's a very good speaker and presenter, but also because the things that she was saying fit in very well with the research that we've been doing over the last 4 or 5 years. So I will be talking about some of the themes that she touched upon, but being much more specific, discussing a specific study of an intervention that we've been developing in Colombia over the last 5 years. This will be I'll be talking about work that I've been doing with a number of co-authors, some of which are listed on the first slide. So let's move on. And the first introduction is simply saying that as John was saying, it's now well established that what happens in the early years is very important, has long-lasting effects on the physical, emotional, and economic well-being of individuals. There's much evidence that is collected and shown on that. And therefore, at the same time, if you take the point of view of economists that have started to look at remedial programs for adult education and the like, there is evidence that says that even these programs have a much stronger impact when they built on the basis of early interventions. So there's more and more evidence that early interventions are very effective in many ways. And partly because they allow us to exploit what we economists call dynamic complementarities. Let me switch to the following slide. And one thing that is pretty clear, and is becoming increasingly clear, is that gaps in development appear very early. This is a little study that was kind of a spin-off of our main study. Partly, this was originated because of our need to build more precise measurement, and I completely agree with the call for better data that John was mentioning a few minutes ago. So we piloted several measures of cognitive development among young children, and this is the bottom of 85% of Bogota in Colombia. So this goes from the very poorest to the middle class in Bogota. The rich are not in this picture. And even within this sample, we can see that by age 6 months, you already see some differences in cognitive development of children, and by age 40 or 42 months, these have increased dramatically. And so there's a pretty clear indication that this type of lags emerge very early, and therefore probably the thing to do is to intervene very early. If we move to the next slide, then the issue becomes, how do we design interventions that are at the same time effective but scalable? And by scalable, we mean that can be afforded in the countries where they are developed, given how much they cost, but also that they are scalable given the social infrastructure and the programs that already exist in some countries. In addition to that, I think there are some interesting questions. We would like to better design effective interventions. We need to understand how these interventions work and what do they do. And we think that probably some of the most successful interventions affect parental practices and parents' behavior. And therefore, we need to understand how parents react to different interventions. Do the interventions crowd in or maybe crowd out parental resources into children? And we need to better understand what different inputs play in the process of development. One thing that when I started doing research in this field I was quite amazed by is how little we know, for instance, still about the relationship between nutrition and cognitive development in the early years. We know there are some connections, but there's still large gaps in the literature. So let's move to the next slide. And So one thing that has been shown, at least in terms of association, is that cognitive development of children is pretty much associated with the quality of the stimulation and learning opportunities and the environment where the child lives. Access to material learning resources and nurturing learning experiences are for children with the foundations for the healthy development and lifelong learning. And what we know in many low and medium income countries, many poor children grow up in households where such inputs are minimal or absent, both in terms of parental inputs, in terms of time and play and stimulation, and in terms of resources. Now, that's a graph that, again, in our Bogota study relates the we collect data information on the quality of the home environment, and then relates the children the cognitive development to the quality of the home environment. Obviously, this is a simple correlation, but I think it's striking. The children who live in households with poor home environment in terms of either play activities or play materials, they also are the least developed. The gradient is amazingly strong. Now, therefore, one would think that this is at least suggestive, is that interventions that might be able to improve children's cognitive development and development in general might go through and work through improvements in their home environments. And indeed, some interventions based on home visiting programs and others have been successful at changing parental practices, both in terms of what they actually do and also in terms of their attitudes, their beliefs in different practices and the like. And in that respect, have been shown to have a positive and long-lasting impacts on several outcomes. Many of these interventions, however, have been very small, and we want to know more about interventions at scale. And that was our challenge, was to try to construct, maybe we can move on to the next slide. Yeah, our challenge was to try to build up an intervention that A, was effective, and B, could be developed at scale. And I'll be more specific about that. So by effect, the Colombian intervention that we designed and evaluated was inspired by the celebrated Jamaican intervention that Sally Grantham McGregor, that was one of the principal investigators in our project, developed 25, 30 years ago in Jamaica. Promotes child development in an integrated fashion and focuses on child-mother interaction through home visitations. The curriculum promotes cognitive and language development, is focused on the mother and children interaction, and teaches through play, is rich in play materials, incorporates concepts and skills to be taught in daily routines, is organized by weeks to match the developmental level of the child to the extent possible. And we tried very hard to keep costs down by using homemade toys and rotating toys. One thing that proved to be very successful was the organization of little workshops to build toys with recycled materials and the like. That's a page of the curriculum on the right-hand side of the slide, just to give you an example of the type of activities. It's very important to stress that this curriculum is designed so can be implemented even by visitors that are not necessarily professional. Is very prescriptive in a way, but for a reason, because we want to be able to do it through the human resources that are available in the communities. Let's move on. So the curriculum is articulated through these home visits like the Jamaica. The main innovation relative to the Jamaican intervention was to use local resources. And the way we did it was to use an existing welfare program. So in Colombia, like in many other Latin American countries, there's been a successful conditional cash transfer program. Within this program, the beneficiaries that are women from the bottom 20% of the income distribution in Colombia elect representatives. Every 50, 60 beneficiaries elect a representative who is called the Madre Leader. Now, these Madre Leaders are very different from the rest of the beneficiaries. They are distinguishable for their leadership skills, as the name suggests, for their entrepreneurial activities, for their education, they're more active, they're different. And therefore, we wanted to draw on these human resources that are identified by this existing welfare program, and we use the network of Madre Leaders to deliver the intervention. So we train and hire Madre Leaders to deliver the psychosocial stimulation curriculum through the home visits. Now, we think this is absolutely crucial. Not only it lowers the intervention costs, but allows the community to take ownership of this intervention. Local women therefore become agents of change within their communities. And I think it makes a very important difference. The fact that the message about parental practices that the beneficiaries receive is channeled through somebody they know, somebody they recognize as a leader, and somebody they possibly trust. And that they might make a very big difference. Now, obviously, this is not easy because we need to identify the right people. We have to adjust the intervention to the ability of the home visitors and to deliver a scale. At the same time, we need to provide adequate training, and that implies also continuous mentoring and supervision. So we did that, and over the last 4 years, this might be a little bit too detailed given the time available. So let's move to the next one. This simply says that these were weekly visits lasting for an hour, while doing this, we also designed a rigorous evaluation of the same intervention, which allowed us to establish what were the impacts that we were having. So we started a randomized controlled trial. So we can skip that maybe. And within this trial, there were 96 municipalities that were assigned to 4 different groups. One was a control group. There was a group receiving stimulation. There's a group that was receiving micronutrient supplementations, and then a 4th group that were receiving both interventions. These were relatively small communities, between 5,000 and 50,000 inhabitants, in 3 different regions in Colombia. Once the communities were assigned to one of the 4 groups, we did a baseline survey. We had the 15 children, 3 Madre Leaders in each town. So each Madre Leader was attending to 5 children. After the baseline survey, the intervention lasted for 18 months, and then at the end of it, we collected a new survey where we measured the cognitive language and non-cognitive development of children. These were very young children. These children were aged between 12 and 24 months at the start of the intervention. So this is pretty much following what was said before, the importance of intervening very early. At the end of the intervention, after 18 months, we measured them again, and at that point, comparing the treatment and the control, were able to find impacts. In this presentation, I would like to stress the impact that this intervention had, not just on the cognitive development of children, which is the most important thing that we did have, but also on parental practices, on what parents do. So here in this picture, we have an index of the availability of play materials in the treatment towns, i.e. where the stimulation happened, and compare to the same measurement in the control town where the stimulation did not happen. And you can see that the yellow line representing the control was the same as the blue line at baseline, And after the 18 months of intervention, the stock of play materials in the households where the intervention was implemented was significantly higher than in the control. If you move to the next slide, we also see the same thing about the play activities that parents do with their children. So what we see is that this intervention caused a change in parental practices that was reflected both in a larger investment in play materials and in play time, in play activities that mothers and fathers do with their children. Just to conclude rapidly with my last slide, so we have shown that an intervention inspired by some earlier successful programs can be replicated in a scalable and effective manner. We have shown that the impact that this intervention has on parental practices and the investment on children. We also have preliminary results that I was alluding to that show that this same intervention has remarkable impacts on children's cognitive outcomes. And so we think that this type of study can be used both for measuring specific impacts and for modeling parental behavior in children's development, and ultimately to inform the design of new interventions to be developed at scale. Thank you very much.
Great, thank you very much, Orazio, for that presentation. Just a quick reminder to participants, you'll feel free to type questions in. We'll get to Q&As after the next presentation. And just to quickly answer one of the questions that's been asked, we will make the slides available after the webinar. We'll also make a video recording of the presentations with the slides available too. So do check the bernardvanleer.org website for that. So let me move on, please, to the final presentation of the day. We're very pleased to welcome Chiara Servili from the World Health Organization in Geneva. Chiara, over to you.
Thanks very much. So good afternoon. I'm very honored to be here, and I'm presenting on behalf of a team of colleagues at the World Health Organization from the Department of Mental Health and Substance Abuse and from the Department of Maternal, Newborn and Child Health. My presentation will focus on the role of the health sector in supporting children's learning and development and on the WHO contribution to the field. So let me mention once again that the early years of life, including the prenatal period, are a highly sensitive period of brain development with greater plasticity in the neuronal pathways. The first 3 years are especially important as this is the period of the most rapid growth for optimal learning and brain development. So I would like to emphasize this, to raise the importance of the health sector for supporting children's learning. If we look at the spheres of influence for development in early childhood, we see that there are that early environments are powerful determinants of how well a child develops and can influence long-term learning trajectories. The environmental factors influencing early childhood development may be proximal, such as, for instance, families' economies, or distal, for example, the ecological and political environments. So what is the role of the health sector? The health sector is very well placed to influence a range of proximal and distal factors that affect child development, such as the quality of the interaction between the parent and the child. The health sector is is probably the only system that potentially can reach all young children and their families, and can reach specifically children under the age of 3 and their families. And generally, families and communities have trust in the healthcare system. If we look at the intervention that have potentially an impact on early childhood development across the life course, we can see that there are a number of them, and a number of interventions that can also be delivered by non-specialists at the level of the primary healthcare system. We define as critical windows of opportunity, especially the period of adolescence and the preconception period, the prenatal and perinatal period, and the early life years, specifically the 0 to 3 years period. To mention a few, the intervention that can have an impact on early childhood development and can be delivered at that level include the promotion of healthy lifestyles and preparation for parenthood, the prevention of poor pregnancy and birth outcomes, the promotion of maternal well-being and mental health, but also the support for optimal feeding practices, detection and early detection of developmental delays and provision of remedial support management of the developmental delays, as well as support for maternal mental health. And lastly, the promotion of responsive care and early stimulation. And I will now talk a bit more about intervention with a specific focus on the promotion of responsive care and early stimulation as tools from the WHO and UNICEF are available to address this specific issue. I will present specifically the intervention, the promotion, the Care for Child Development Intervention package that has been recently made available by the WHO and UNICEF. And it aims to improve the healthcare provider skills to support care for development. It is available now as a standalone module as well as a part of an integrated community-based childcare package, specifically the Caring for the Child's Healthy Growth and Development. Both of them are available on the WHO website. The Care for Child Development package is based on the best available evidence and is a set of materials that complement the traditional package of child survival interventions. The intervention is meant to guide health workers and other counselors in supporting families to build stronger relationships with the children. The intervention can be used by health and community health workers to provide age-appropriate guidance to caregivers of young children for stimulating the cognitive, language, and social emotional development through play and communication. And ultimately, the intervention contributes to psychosocial stimulation of the child and caregiver sensitivity and responsiveness. You may see now this slide that is showing one of the counseling cards that is part of this set of tools. It includes age-appropriate recommendation on how to play and communicate with children. The Care for Child Development package, in fact, is providing caregivers with at various stages in their child's life, and specifically from the newborn period up to 3 years, with specific guidance on how to stimulate and advice on what to do if the household lacks toys, and how to deal with cases of maternal stress or where caregivers have little time for interaction with the child. The skills taught affect multiple caregiving practices, including infant and young child feeding, protecting a child from imminent harm, and also recognizing and seeking care when the child is sick. This package has been adopted and tested in several countries now, and has been used by a variety of care providers, including nurses, pediatricians, community health workers, family physicians, and primary health facility nurses. The next slide is providing the list of countries where the package has been used and pilot tested. There is ongoing work in India and Malawi and Pakistan at the moment. Now, I would like to briefly mention also, the WHO, current WHO efforts in the field. So, besides the development of the Care for Child Development package, the WHO is currently willing to intensify its work in the area of early childhood development, and this has been mentioned also recently in a Lancet commentary by the Director General, Dr. Margaret Chan. The Early Childhood Development Program within WHO is currently aiming to improve the integration of interventions to promote early childhood development in health across the life course, with a particular emphasis on the year 1 to 3 and the adolescence and preconception period. The current challenges that have been identified include inadequate information on effective implementation at scale, poor coordination across sectors, lack of monitoring indicators, as already mentioned by the speakers, and no agreement on definitions on early childhood development. For this reason, a meeting has been recently convened by the WHO in January 2013 that brought together participants from a range of disciplines that are concerned with development across the life course. The technical consultation had as objective to describe the current evidence on pathways and factors that influence early childhood development, sharing evidence of effective interventions across the life course again, reviewing indicators and tools for the development, for assessment of development at different levels, so population-based assessment as well as individual-based assessments. And it aims also to promote the exchanging of experiences for in implementation of effective early childhood development programs at scale. And during this consultation, participants reached agreement on a list of priority actions that include the preparation of a special series on the theme of early childhood development and the health sector, the development of the guidance document on the role of the health sector in promoting early childhood development, specifying how linkage is enhanced for groups at risk, and also the development of a framework for developmental monitoring and evaluation, again focusing on the age group 0 to 3. So I think this is all concerning my presentation, and I would like to reiterate that WHO is committed to the field of early childhood development and willing to work in partnership with others to advance this field in the years to come. Thanks.
I think we had a question for Orazio about how to access the curriculum, and from several of the people listening in.
Yes.
And I should also add that we had some, looks like we had some technical difficulties advancing the slides in that last presentation, but we'll have them up online. Orazio, you want to tell
Yes,
our participants?
I saw there were a couple of questions.
Sure.
So the one on the participation of somebody asked how difficult was to convince parents to participate into this intervention. And this is a question that we often get, and that was not really a problem. Although you know, although we were operating through the conditional cash transfer program, in the sense that they knew there was a connection, because the visitors that we trained and hired were the leaders of the program. We made it clear that we were completely different. Definitely participation was not the condition for them to receive the cash. But as a matter of fact, we never had any problems in parents' participation. So I don't know whether we were lucky or simply there was actually quite a bit of interest. And some activities were a huge success, like this the workshops that we organized to build toys, as I mentioned before, they were very successful. In terms of the curriculum, as I mentioned, the curriculum was inspired by the Jamaica study that is now 25, 30 years old, and it's very structured. And I don't know to the extent to which it's publicly available. What I do know, however, is that we had to do a fair amount of work to adapt it to the specific context of Colombia. So I don't think there exists a curriculum that can be just taken off the shelf and replicated. exactly because the curriculum, the intervention puts so much focus on the stimulation and on the parental participation. It's very important that the activities are designed taking into account the cultural context in which one operates. For instance, we have recently been doing some work with the Peruvian government to, in collaboration with the IDB, to do something similar, inspired by what we have done in Colombia, and we are now working on an intervention in the Orissa in India, and lots of work and effort is going into adapting the curriculum. What I think is definitely available is the general philosophy and the principles that inspire the curriculum, and I'm willing to answer emails and on more specific details.
So what's exciting here is that we have heard of interventions, one coming more out of a social protection system and the other coming out of a health system. And in both cases, we know that adaptation is going to be important. We'll be putting together a resource list that will go up on the Bernard Van Leer website where you can access more information about these particular curriculums and other parenting reviews. I know that Linda Richter is a participant on this, did a terrific review of the literature around parenting. We'll also put the link up to that resource. So other questions? Chiara, do you want to say a few words about what the next steps will be that WHO will take to move the data issue forward?
Yes, there is a working group that has been established following the technical consultation in January this year that is currently working specifically on the framework for developmental monitoring and population-based assessment instruments. So that the working group is currently looking at available instruments to improve the availability of data to collect population-based information, including, for instance, the UNICEF MIX instrument.
So you'll be working together with UNICEF and the other UN agencies.
Right, that's correct.
That's very exciting to hear. Chiara, what have you found, one of the questions that we got is, what have you found to be the most convincing argument for the integration of early childhood development services more specifically into the health system?
I think the most convincing argument is, again, the age group. That we, especially in low-resource settings, the healthcare system is probably, provides one of the very unique opportunities to meet with children of that age and their parents whenever they come for other reasons, for instance, for vaccination or for because a child is sick. So the health system has the potential to exploit every occasion, every opportunity to meet with young infants and young children and their parents and promote the early childhood development during that encounters. So I think, one of the care for child development is very simple, but it has been designed to be very simple in order to be included in routine care practices. So whenever the opportunity arises, it can be included in the health visits by the primary healthcare providers.
So it provides us that universal platform that we've been looking for to intervene with very young children. And that's why that Care for Development package is so important. Orazio, we had a question about what you thought was the absolute key element to the quality of service delivery. What are the things that you just cannot compromise on?
Well, I think a couple of things. One is the frequency of the visits, and the reason is not much an issue of intensity, but because my idea is that this intervention builds on tries to build practices and tries to make a certain number of activities a routine, introduce new routines within the family. So there is lots of stress, for instance, on language stimulation, on talking to the child. And if that has to be effective, you have to have a certain continuity in the intervention. So I think, you know, we aim for weekly visits. De facto, they were maybe every 10 days or so. I don't think we could go, you know, at lower frequencies than those. The second thing is what I mentioned during my presentation. In terms of scalability, I think what matters, and the fact that we do this with the local women is absolutely crucial, not just because it makes the intervention cheaper, but because it fosters community participation and ownership. And I think that's really, really important. Because whenever you want to convey a message about information, about appropriate practices, I think it's really, really important that you channel this through the appropriate people and through the appropriate agents of change.
Okay, and I should note here that our great moderator in the beginning of the session's computer crashed, so that's why you're hearing Joan rather than Andrew. But I'm going to continue with those questions. We have a question from Yvette, who says, as a public health professional currently working in child rights and protection via philanthropy, I'm constantly challenged by the lack of collaboration between the sectors. And Yvette, I think that's the sense that many of us feel. Could the panelists speak a bit about the gains and setbacks in working cross-sector to address early childhood? And I'll let the other panelists comment before I comment myself. Either Chiara or Orazio, what are the challenges of working cross-sectoral?
One of the challenges that I can mention is also language. You know, one of the issues that was discussed during the technical consultation here at WHO earlier this year was definitions around early childhood development, because it seems that, you know, we cannot even reach agreement in terms of definitions of, you know, for instance, what are we referring to when we talk about early childhood development, early childhood, you know, what age group, and so forth. So there is also, you know, an effort in that direction to try to harmonize the vocabulary and then, you know, hopefully to try to build on you know, to build on opportunities for integration across sectors.
And Orazio, any advice?
Yes, first of all, I completely second what Chiara just said. You know, often, especially, I think at the same time, it's extremely exciting and profitable to work across disciplines. There is lots of cross-fertilization. Personally, I'm an economist, but I've been learning a lot from psychologists, from nutritionists, from child development specialists, and the like. And I think each discipline, yes, it's true that it's difficult to speak cross languages, as Chiara was suggesting, but it is also extremely profitable, and we can learn a lot. The other element is that it's more a political economy consideration, is that I've seen that in several developing countries, but probably the same is true in developed countries, these type of interventions fall under different jurisdictions and different systems, and that can create quite a bit of problems. So, you know, 0 to 2, does it belong to the Ministry of Health or Education or Social Protection? And there are lots of institutional jealousies that can jeopardize the, you know, the development of these programs.
I think it always helps if we keep in front of us that a child doesn't come with a health issue or an education issue. It's to remind ourselves every day that it's a whole child that we're trying to develop. And the openness that I think both of our, all of our panelists showed today to that collaborative spirit, it's tough on a day-to-day basis, but we have to continue to remind ourselves that it's the whole child that we're after. We have several other questions here. Chiara, are the health communities, agencies to promote, are they ready to promote learning, do you think, from birth on? Is learning a term that we can be using with the health community?
I think so, especially, I think, we often use promotion of care development, but in fact, when we want to to evaluate the impact of some of the intervention concerning the promotion of child development, we look at learning, and school outcomes as an outcome. And I think, I mean, it's true that, this is, again, the issue of terminology, but I think we are moving in that direction. So I would say that we are reaching a point that we should talk about promotion of development and early learning, even if we are coming from the health sector's background.
So we have several comments also from our participants. For example, from Mark, reminds us that collaboration does happen at the grassroots level as well as the policy level, and I think that's particularly important because this is where service delivery happens and where the integration is so key. So Mark, a good reminder to all of us. This is, I think, to Orazio. Were all the toys remaining with the families after the home visiting program was completed? Or
so well, yes and no. The way it worked is that the mother leader, as I mentioned, each mother leader was attending 5 children. And so the original training of these mother leaders in a town would teach them, among other things, how to build these toys in these little workshops. And so they would build a number of models of these toys, and they're all varieties. It's actually some beautiful ones. Those were used as a toy library, as the question suggested. However, the idea is that this was not difficult to do, so they were discussing with the mothers how to build these toys with plastic bottles.
And that was the important part. One quick, we have only about a minute left, Orazio, and Debbie has been asking, waiting for the impact on the nutritional supplements. Can you say anything about that briefly?
Yes, very briefly. From what we know until now, there were none. And that was a big disappointment to us. The nutritional supplements were micronutrients. We're looking into it. We don't know whether that was because lack of compliance with the delivery of this micronutrient supplementation or what else. This is something we're still investigating.
So we need a lot more discussion about what goes into these interventions and what we're getting outcomes around which domains of development. Well, I'm going to throw this back to Andrew, who I think has his computer up and running now. And Andrew, why don't you take it away?
Thank you very much, Joan, and apologies once again to everybody for, I understand that the slides got stuck around about halfway through Chiara's presentation. And then my computer crashed altogether about 5 minutes after that, so terribly sorry about that. I would like to remind everyone this is the first time the Bernard Van Leer Foundation has tried this. We're attempting to coordinate this from 5 different countries in total, so it frankly would have been a miracle if nothing had gone wrong. We hope that the next one will be altogether more professional and polished. But we will tidy everything up. We'll get these slides available on the Bernard Van Leer Foundation website. We'll also tidy up the videos so that you can see slides in conjunction with Chiara's presentation, and we'll get that online as quickly as possible too. So please do keep checking the website. We'll get those up as quick as we can. And thank you again to Joan Lombardi, to Orazio Attanasio, and to Chiara Servili. We hope you all enjoyed it, and we hope to welcome you back again for another webinar after the next edition of Early Childhood Matters in another 6 months' time. Thank you very much.
Thank you.